Hey, Dr. Manchanda.
What do I do?
How you doing? How's your quarantine been?
Hanging in there, man. How about you?
Same. Doing the best that I can today. Hunting
Yeah,
the joy wherever it is.
hunting the joy. I'm going to borrow that, my friend.
So, as you know, it's a big deal for us. You know, we've got you here in the flesh. We started out just having you on the YouTube, and now we've got you here in the flesh. Um, in the TED Talk that we use, you say medical care is just one of the components that shapes our health, but that we need to look upstream to what makes us sick in the first place. What are other important contributors to our societal and individual health?
Yeah, thanks, Andrew. First, thank you for again just having me on the show. I'm joining many other fans out there of yours, so and I can't thank you enough for the public service that you're doing just through these forums and the kind of engagement. So thank you for having me. It's an honor to join you. So upstream, what does it mean? In the TED Talk and in general in my work, I often tell the upstream parable, but I tell a version of it that folks may not have heard before. For those who haven't even heard the parable, let me tell it to you this way, and then hopefully this becomes your default. In the story, there are, imagine three friends who come to a river. In the river, they realize that there are people, there are children, adults, the elderly, and they're not leisurely swimming. They're actually struggling. The tide is really strong. They're being rushed towards, in fact, a waterfall. So they're in peril, and they're crying out for help. The first friend, all three jump in. They do what a lot of people do in both healthcare and in social services, in human services, and in life in general. Most of us do what these three friends do, which is to jump right in and help. First friend says, I'm a really strong swimmer, so I'm going to go to those folks who are they're about to fall over the edge of the waterfall and rescue them. One by one, I'm going to try to save those lives, the people who are most vulnerable, most acutely at risk. And now the rest of us who have gathered along the banks of the river say, yep, that person is doing the right thing. Let's applaud that person. Let's give whatever resources this person needs, whatever she needs to be able to rescue folks. Let's help that rescuer. After a minute, we see the second friend who's doing the same thing, saving people. But she recognizes something interesting. She says, if I gather these branches and these logs across the banks of the river, and I get some twine and I put these all together, if I coordinate these branches together, I can build a raft. And as I build this raft, I can usher maybe 20 or 30 people. For every one person that my rescuer friend is helping out, I can save 20 or 30 and get them to safety at the edge of the river. The rest of us now say, well, that's a smart idea. That's great. What resources can we give you? That makes total sense. So now we're seeing these two friends in the water. And so far, what we've described is the story of American healthcare, the conventional story, the story of the rescuer, right, and the raft builder, the specialist, the ICU nurse, the trauma surgeon, the oncologist, the people that you want when you're in dire straits, right? When you're acutely at risk of having an illness, a trauma, a sudden urgent issue, a crisis medically that we need help with. No doubt we need them. We also know that we have the raft builders, the primary care clinicians, the care teams, right? The nurses, the doctors, the physician assistants, the medical assistants, the community health workers, who are part of that raft building exercise to get more people the help they need so that they don't end up actually at the waterfall's edge, so they can stay as healthy as possible. That's the story so far of American healthcare, and it's a really good story. It's a really good model. The problem is that in this story, in the parable, these two friends, they do what happens in a lot of rivers across America. They show up day in, day out at that river to help. The rescuing continues, the raft building and the rafting kind of continues. And sometimes our friends get fatigued. They say to people in the water that they're saving, they say, look, it's you again. Didn't I save you last week?
Mm-hmm.
I mean, didn't your mama teach you how to swim? I mean, come on now, right? Out of their fatigue, out of their the cognitive dissonance, they don't really understand what's happening here. Why are these people still in the water? What's going on here? They start getting burned out. And sometimes they even say really ugly things to the people they're there to help, right? They say hurtful things sometimes. The biases come out, the ugliness comes out, and sometimes we turn on the people we're trying to help to explain away our own dissatisfaction with a broken system. Mm. But more often than not, our healthcare and other service industries, right? People, raft building rescues continue, and it's noble work. And in this story, the two friends recognize, wait, there was a third friend who jumped in with us. Where is she? and they finally spot her. She's way further upstream, and she's saving people as she's going, but she's swimming away. And they shout to her, "Yo, what's going on? There are people here to save." And she shouts back, their third friend shouts back and says, "I know. I'm going to find out who or what is throwing these people in the water."
Mm.
The story of American healthcare has always included, and turns out, that the three friends, the practitioners, the professionals, the committed individuals who sometimes have even sworn an oath to help, to heal, to serve, and oftentimes find that it's not just about the rescuing and the raft building, but we also have always had people in our midst, people I call the upstreamists, right, who are trying to help people, trying to help all of our teams, our care, our clinics, our hospitals figure out who or what is throwing people in the water. The upstreamists are the ones who build bridges with public health, build bridges with housing agencies, with food systems, with upstream partners in the law, even to think about how we can fix what's throwing people in the water in the first place, what's making people sick in the first place.
Right.
We need that. And what's making people sick in the first place, to get finally to your question, right, directly, what are these upstream factors? Well, they include all of the things outside of medical care. For example, where we live, work, eat, sleep, and play, the living and working conditions in our communities, whether, for example, there's a food desert that you live in, where that in one geographic area, there's just no access to buy affordable, healthy food, right?
Right.
Or you live in an area that's been historically redlined, and so access to affordable housing and other opportunities like access to parks or public amenities like the post office or a good police department or local social services, like all the things that you think are part of a decent community. If you don't have access to that because this community has been historically redlined, well, that's defining the living and working conditions. So the upstream factors are all the social, economic, and political conditions that shape health in the first place. And it turns out those factors have more than 5 times the impact, at least 5 times the impact on how long we live and how healthy we are than all the pills and the procedures that doctors can provide. And so as a doctor, what I found in my life is, how can I now better connect my work as a caregiver to the work of finding out what is actually throwing people in the water? And that's the work of being an upstreamist. That's the work of moving upstream.
So what does upstream medicine and kind of the upstream theory look like in terms of something like COVID-19?
Yeah, well, I mean, COVID has done what a lot of infectious diseases have done throughout history, which is to exploit and reveal the deep inequities that exist in society, right? There is no surprise to any expert in infectious diseases or in healthcare or in the social sciences, right, to see that COVID has disproportionately infected and harmed and killed Black and Brown communities in America. And it's not because of any intrinsic kind of genetic differences. It's not like that race explains it. It's that racism explains it, right? Mm-hmm. It's because of it's not just, and I don't mean racism in terms of interpersonal racism, like if you're biased or prejudiced. I mean the racism at a higher level, which is institutionalized, or what people call structural racism, right? Whether we're seeing it play out even with the vaccine issue, but it played out even early in the pandemic when we were talking about testing, right? Or we were talking about access to medical care in the first place. At every step in this pandemic, we've seen that, whether you have good access to healthcare, whether you actually are in an environment, whether you're in a job which puts you at a higher risk of getting exposure to COVID, right? Whether you're in a job or in a community that has easier access to personal protective equipment, masks and whatnot, whether you're in a country that is going to provide you with the economic vaccine, right, to inoculate yourself against the harsh economic kind of impact that this had on people's lives. Time and again, what we see, in other words, is COVID has revealed the fact that it's not just health equity that we have to care about. We have to understand and address the social and the structural drivers of health equity, because that's what COVID has taught us again and again. And the last thing I'll say is that, thankfully, what we're seeing now more and more over the past year, and especially the past few months, is more and more people at the highest levels and in communities front and center, whether it's in Sacramento or in LA or in any parts of California. We're seeing more and more leaders understand that equity is the only way to be effective, right? We can't just care about equity when it matters to a certain, for a certain, when it's campaign time or when it's time to kind of talk a good game, but really kind of move on to other business. Equity is the only way to actually effectively mitigate the impact of this pandemic, and frankly, to not just recover from this, but to reimagine what society needs to look like.
I always say that equity isn't a conversation. It's the beginning of every conversation and needs to be. All right. So, I mean, thank you so much for shedding some light on all of that for us. The question, now I have one more before you go, because this is the question that I ask everyone that comes on this show.
Uh-oh.
Where's your joy coming from?
I like that one. Okay. I was wondering if there's going to be a curveball in there, but that
one. Oh, yeah. This is my gotcha.
I'll take this gotcha any day. Where is my joy coming from? It comes from, the people I love and the people I have the privilege of working with. People I love. Yesterday was my wife's birthday. I had a chance to, last year, pre-COVID, I was working in life, and we've got our kids and all that stuff. But I mean, this last year, the humbling experience, right? The gravity of what's happened this past year, and also the reality of being able to actually have to just figure out how to spend time with people, more time than you otherwise do. The fact that I'm working from home more often than not means that I'm spending more time with the people I love. And I've had on the flip side, the silver lining that I've been able to kind of celebrate people I love. And yesterday, because of your background in poetry and in music, you'll appreciate this. I worked with an artist, and we got a song together for my wife's birthday. And
wow!
Yesterday, 3 minutes, and man, it was just joy. Just kind of see the smile on her face to see this music. So I got the joy of actually watching somebody actually start to tear up because of the power of music, and it was lovely. So that's where my joy came from. Just it's fresh of mind right now, and the people I work with is the other part of it. I get to work with people across the country who are moving upstream every day. Leaders in hospitals and healthcare systems, leaders in public health agencies, leaders in communities who are fighting not just against the pandemic, but fighting against injustice. And man, the energy, the joy that I get from doing whatever I can to help elevate their voices, to support their work right now, fuels me every day. So I get joy from people I love and the people I work with, and it's a privilege every day.
Right on. Well, thank you so much for joining us, Dr. Manchanda. It was more than we bargained for, because we were just here to talk about upstream medicine, and what we also got was how to keep a relationship fresh. You know what I mean? Y'all make sure that you talk to your artists, holler at your local artists out here. But man, thank you so much for joining us, and we'll have to have you back to talk more upstream medicine sometime.
Lots of love, man. Thank you so much. Be well.
Bless.